What is cough-variant asthma, CVA? Imagine having a persistent cough that just won't go away, no matter what you try. That's often what people with cough-variant asthma experience. It's a type of asthma where the main symptom is a dry, hacking cough that lasts 4 weeks or even months. And like typical asthma, you might not notice wheezing, shortness of breath, or chest tightness. This makes it tricky to spot because the cough is the only sign. The cough usually happens during the day or night and can disturb sleep. It can get worse when you exercise, breathe in cold air, or come into contact with allergens like dust, pet dander, or strong fragrances. Some people find that certain irritants or respiratory infections can also make the cough worse. Because the cough lasts longer than 6 to 8 weeks, doctors often consider it a chronic cough. Cough-variant asthma is quite common and is one of the leading causes of long-lasting coughs. It can affect anyone, but children with asthma are especially prone to it. If it's not treated, cough-variant asthma might develop into classic asthma, which includes wheezing and breathing problems. The exact cause isn't fully understood, but it's believed to involve airway inflammation similar to regular asthma. Triggers like allergens, respiratory infections, cold air, and certain medications such as beta blockers can set off symptoms. Some people are sensitive to aspirin, which can also cause coughing episodes. Diagnosing cough-variant asthma can be tricky because the dry cough can be mistaken for other issues like post-nasal drip or acid reflux. However, the key feature is airway inflammation and increased airway responsiveness, which are signs of asthma. Doctors often use lung function tests to check how well your lungs are working and to see if your airways react strongly to certain stimuli. Treatment usually involves inhaled corticosteroids to reduce airway inflammation and bronchodilators to help open the airways. These medications help control the cough and prevent it from worsening. Managing triggers is also important. Avoiding allergens, irritants, and respiratory infections can make a big difference. Early treatment is vital to prevent the cough from turning into more serious asthma symptoms. In summary, cough-variant asthma is a type of asthma marked by a long-lasting dry cough without the usual signs like wheezing or chest tightness. It's important to get diagnosed and treated properly to keep the airways healthy and prevent future breathing problems.